Good morning, everyone. My name is Tang from Department of Neurology, Hanoi Medical University Hospital. Today, I will present our study about neuromuscular manifestation of paraneoplastic syndrome in our hospital from March 2023 to February 2025. So, paraneoplastic syndrome is a group of disorder caused by immune reaction to cancer, but not caused by tumor spread. So, it can affect many organ system, especially central nervous system and peripheral nervous system. In our research, we focus to the neuromuscular feature of the person, and our role is to describe clinical feature and laboratory finding and diagnostic aspect. This is a retrospective descriptive study, and between March 2023 and February 2025, we reviewed medical record of 5 patients aged 18 or older who suspected neuroparaneoplastic syndrome according to the PNS criteria 2021. We have 5 patients, and only 1 patient had isolated sensory sensitive symptom, and 4 other cases has a motor symptom. Case 1 is a 60 years old man with history of small cell lung cancer, diagnosed in 2024. He was admitted with ascending paresthesia asymmetrically for 6 months in glove stocking distribution and right side predominance, and right imbalance for 4 months. On examination, we note the loss of superficial sensation and sensory ataxia, including stopping gait and pseudoathetosis. We note no motor weakness in this patient. On EMG, EMG indicate a sensory ganglionopathy with asymmetrical reduce of sensory nerve action potential and normal motor conduction. On CT chest, we find right lower lobe mass. He confirmed his medical history of small cell lung cancer. As paraneoplastic antibody, we find 3 high-risk positive antibodies such as anti-Hu, anti-SOX1, and anti-amphiphysine. According to the PNet criteria 2021, the antibody, high-risk antibody is strongly associated with small cell lung cancer and other malignancy, and their presence in this patient have diagnosed the neuroparaneoplastic syndrome. We calculate PNS care score at clinical level. This patient has high risk phenotype So scoring 3 points at laboratory level, this patient has three positive high-risk antibodies, so scoring 3 points, and he has a small cell lung cancer, so total cost is 10 points. According to the PNS criteria, the 2021, this patient meet the criteria for definite PNS. Other four case was between 49 and 65 years old, with 3 male and 1 female. None of them had medical history of cancer. The clinical presentation is isolated motor weakness with or without gait imbalance and no sensory loss. We found paraneoplastic antibody in three cases. And the most common is anti-Hu in 2 patients, followed by anti-SOX1 in 1 patient. EMG show Lambert-Eaton myasthenic syndrome with augmentation of motor compounds action potential after 10-second exercise test. CT chest, so evidence of suspected malignant lung lesion was found in all patients, but only 1 patient had confirmed result of small cell lung cancer in a biopsy. So in conclusion, in this study, we present 2 red flag neuromuscular manifestation of paraneoplastic syndrome, including isolated sensory loss, suggested sensory ganglionopathy, and isolated motor weakness similar to Lambert-Eaton myasthenic syndrome. The red flags for neuroplastic syndrome is very useful for raise immediately suspicion of paraneoplastic syndrome, and EMG is one of the most important tools for diagnosis. Detection of paraneoplastic antibody is one of the it's very useful for paraneoplastic neurological syndrome and begin treatment sooner. Thank you for listening.